Well, I've always considered myself a kind of cutting edge guy. I like to make sure that I'm doing the best thing for my patients, and sometimes technology has really moved rapidly forward, and I want to use some of that technology to my patients' advantage. So more recently, about 3 years ago, I came across Think Surgical, and I thought they had some really brilliant ideas. And there was some history behind this where it showed me that there was robotics that were involved, as well as some of the computer advances that had taken place that allowed me to take better care of patients, I believe, through more accurate surgical execution. There are many different implant companies out there, and they make different designs and different shapes of implants. And just as you are different from me and every person's unique, I can now use the workstation to determine what exactly fits your anatomy the best. And so then I move forward with what plan works best for you. I think Surgical's done some really amazing things for my practice. Historically, I'm an arthroplasty trained surgeon. I've done this for over a decade. I think I'm fairly technically adept at it. However, no one's perfect, and we all have sometimes we wish things could be a little bit better. Well, one thing Think Surgical has provided for me is the comfort of knowing that every time is going to be exactly like I planned, because there is no messing up for this device. It works perfectly just as planned. It executes the plan as it's told to. And so giving me the ability to look at the 3D workstation and plan the surgery beforehand just gives me a comfort level that just wasn't possible before. More specifically, I get a chance to look at each patient individually, look at their anatomy, find the special things that make them special, such as is their alignment something unique that I couldn't pick up on a plain x-ray that's a two-dimensional representation of a three-dimensional person. With the 3D workstation, I get all types of different views: coronal, I get axial, and I get sagittal views of the hip. And so that lets me plan in 3 dimensions that's more accurate than anything we've ever done before. It does give me a lot more peace of mind. I have to give you a story. You can figure out how you want to take this, but not everyone's a candidate for this. And when I have to go back and do it the way I did it before, it brings a lot more anxiety to me, because I have to be more attuned to all the different things that feed into me to make it right. Sound, feel, and it's not precise at all, is the truth. And I don't rest as well until I see that x-ray. There's a lot of anxiety. However, when using Think Surgical's tools, I know that it's going to look exactly like the plan.